Hello again, and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX.
Today, we're excited to talk about a topic that's becoming more important as marijuana use becomes more common across the U.S. How cannabis can affect your heart health.
Yeah, despite the chill reputation, cannabis or marijuana or Mary Jane or whatever you want to call it may not be as chill for your heart as you might have thought.
Exactly. So let's roll up our sleeves and dig into what the research says.
Well, first, let's take a moment to do a little background on cannabis. Marijuana has been used for centuries for medical, recreational, and spiritual purposes. Now, fast forward to today, nearly half of U.S. adults have tried marijuana at least once, and recreational use is legal in 24 of our states.
Wow. That's a lot of people potentially lighting up and not realizing that there are some risks for their heart.
Right. Let's get into the facts. According to the American Heart Association, the CDC, and recent Harvard Health studies, using marijuana, especially when smoking it, can significantly increase your risk of heart problems.
Researchers found that cannabis users have a 25% higher risk of heart attack and a 42% higher risk of stroke compared to non-users.
Wow, that's not at all mellow.
And it doesn't seem to matter whether you're smoking, vaping, or eating edibles. The THC itself can still affect your cardiovascular system. The method of use can increase the potential health risk, however.
All right, so let's try and break this down a little bit.
Okay.
THC, which is the main psychoactive chemical in cannabis, causes a quick spike in heart rate. It raises the blood pressure, and it also messes with how your arteries function. It basically sends your heart into a sprint while you're just trying to chill on the couch.
And here's the kicker. If you're smoking cannabis, you're also inhaling carbon monoxide, tar, and other toxic chemicals. And it's kind of similar to what you would expect from cigarette smoke. And that damages blood vessels directly, causes inflammation in the body, and increases the risk of blood clots, strokes, and heart attack. Not to mention, not great for your lungs.
Right.
Or your throat, or your mouth,
So if you think joints, blunts, bongs, or pipes are all natural, your heart strongly disagrees.
And natural doesn't mean good for you. Because, arsenic is natural.
Okay.
So
And so are poisonous mushrooms
Yeah, and you don't want to do those either.
and poison ivy.
I missed that part of this.
Okay.
Okay.
Just kind of like going off of all the things that I know are natural but are not good for you.
Gotcha.
Lead is natural. And
Oh yeah, lead.
All right, let's get back to
Okay.
the topic
Okay.
at hand.
Okay.
Let's talk about edibles.
Okay.
You may skip the lung damage part because you're not inhaling smoke, but don't celebrate just yet. The THC is absorbed through digestion, and that still stresses your heart. It can still raise your heart rate and your blood pressure, which can lead to cardiovascular issues, especially at higher doses.
In other words, eating a gummy is maybe less bad than smoking a joint, but neither is a love letter to your arteries or cardiovascular system or heart.
Okay, and let's not forget, edibles can be sneaky.
Do they sneak up behind you?
They do, and they're quiet because they're soft.
Okay.
They take longer to kick in, so people often eat too quickly and too much. And by the time they realize it, their heart is running a marathon that they did not sign up for.
Pretty interesting
It's
way to put it.
ridiculous. If you're taking, okay,
Yeah, okay. I know it's you
common sense would be nice.
well, you expect the opposite effect, but it's not great for your heart. Okay.
Nowadays, common sense is common.
Yeah.
Oh, that's a different script. Sorry.
Mhm.
Older adults. Let's talk about some older adults.
Okay.
Especially people with existing heart disease and those with high blood pressure and high cholesterol or diabetes. Those folks are especially at risk.
But even in young, healthy people, they're not immune to the side effects. And some cases have been reported of sudden cardiac deaths in young adults shortly after cannabis use, especially when combined with exercise, alcohol, or other drugs.
So it's not just about your age, it's about what's happening inside your body when you introduce THC.
And actually, let's say this: beyond the physical, beyond heart attack and strokes,
Yeah,
Hmm.
um, marijuana use can also lead to arrhythmias with the heart.
Oh,
Um,
we know
and
about those.
yeah, they're irregular heartbeats. Also cardiomyopathy, and that's where the heart muscle weakens and cannot pump blood properly.
okay. And combining cannabis with other substances like tobacco or maybe alcohol, that can compound the damage. So mixing cannabis, tobacco, and alcohol can be detrimental to your health, and it's kind of like trying to play Jenga in an earthquake
A
or
pretty
during
in-
an earthquake.
a pretty interesting analogy.
Yeah.
Yeah.
And how about vaping cannabis? That's not a free pass either. Research shows that vaping still stresses the heart and arteries. So if you were hoping that a fancy pen would save you, bad news.
Actually, right now, doctors are routinely asking about marijuana use when they're doing cardiovascular evaluations on patients, especially when those patients come in with chest pain or palpitations or unexplained strokes.
So if your doctor asks you about cannabis use, don't lie. They're not just asking, for their health. They're asking for yours. It's to make sure that you don't become a case study or an example. They want to know so that they know how to treat you properly.
And if you're using marijuana and you have heart risk factors, or if you experience any heart related symptoms, talk to your healthcare provider. They might recommend lifestyle changes, quitting cannabis, or closer monitoring.
And of course, healthy habits like regular exercise, a balanced diet, managing stress, and avoiding tobacco and excessive alcohol, that also helps. Um, Try this. Think about spinach salad and yoga, not nachos and bongs.
And always remember that moderation might be the key to saving your heart and your wallet. And considering that ER visits are not cheap.
And more research is being done every year on this. Scientists are now digging into whether the method of use, for example, smoking versus edibles, the type of THC product, or even CBD content, if that can change the level of risk.
But the takeaway for now, cannabis is not heart neutral. Even without smoke, THC itself poses real cardiovascular risks.
So it's whether it's medical or recreational, you should know that there is a risk. And your heart doesn't care about marketing slogans. It cares about the oxygen and the blood flow.
Well, speaking of that, there was
Hmm.
a study from Stanford published in 2022, which even linked marijuana use to an increased risk of coronary artery disease, or CAD. And what that is, it's the buildup of plaque in arteries that can lead to heart attacks. And the risk was higher even after controlling for age, sex, and other health conditions.
Wow, that's huge, especially since CAD is already the leading cause of death in the U.S. It's not something you want to play around with.
And here's something else.
Hmm.
While CBD is often seen as the safe compound in cannabis, it's not entirely off the hook either. High doses of CBD may interact with medications,
Mm.
including blood thinners and heart rhythm drugs. I wish they would say how high of a dose, but anyway, potentially causing unwanted side effects.
And do not forget about synthetic cannabinoid. The stuff that's sold as,
At the gas stations?
I guess,
Yeah.
yes, goes by names of spice or maybe K2. These are even more dangerous. They can cause intense hypertension, chest pains, and severe arrhythmias. And some ERs call them cardiac chaos in a bag.
And there are even real world cases of people collapsing after a single use of these. So it's scary because they're not really regulated, um, as well as other products or as a medication might be.
Exactly. Which brings us to the policy side.
Okay.
While cannabis is legal for recreational use in over 20 states, many public health professionals are urging lawmakers to include cardiovascular warnings on packaging, kind of like tobacco warnings.
Okay.
Right. um, you get a warning label if you take ibuprofen, but you do not get a warning label if you're buying a 90% THC concentrate. Kind of see where the gap is there?
Yeah.
Yep.
Yeah.
Yeah.
And in some states like California and Colorado, they've started to track the cannabis related ER visits. And one study in Colorado actually showed that after legalization, ER visits linked to cannabis use almost doubled. So especially with cardiovascular and psychiatric symptoms. Mhm.
Yeah. Yeah. And I guess it's Colorado's the one to follow since they
Started
got,
it. Yep.
they got their legal limit first.
Yeah, and I do wonder about other, like countries overseas where it's
They've
also
been
been.
using it
Mhm,
forever. Yeah, that's what they should study.
mhm.
Meanwhile, medical cannabis patients aren't always given guidance on how their prescriptions could interact with existing heart conditions. Education is lagging behind legalization.
And that is why open conversations with healthcare providers matter so much. And that includes the pharmacists too, who can check for drug interaction.
And I guess it does depend on whether or not, like the American Heart Association or, different organizations, what they decide is the best policy. And then they have to put that information out to healthcare providers so that they have it to provide to their patients. Another piece of the puzzle is the research access. Because cannabis is still federally classified as a Schedule 1 drug, it's been really hard for scientists to get funding and approval to study it deeply. And that's finally starting to change, but there's a lot of catching up to do.
Yeah, we're kind of in a weird in
Mm,
between moment.
yeah,
The public sees cannabis as safe and natural, but the science is still playing catch up
right,
and the heart risks are real.
right.
Well, while this episode isn't anti cannabis, it is pro awareness. Purpose for this show today is we want people to have the full picture so that they can make informed decisions, especially if they already have health conditions or are on medication.
Right.
Right.
Because after researching this topic, I decided that whatever edibles I've got left are the last edibles I'll ever have.
Choice you had to make for your health. And keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Thanks for tuning in to this episode of Podcast DX. And remember, keep your heart happy. Maybe give it kale instead of cannabis.
Yeah, they're both green. Till next week.